Have you ever felt like your body is working against you? You eat well, you try to stay active, but your energy still crashes, and those stubborn pounds won't budge. What if the key to turning things around isn't about doing more, but about doing the right things in the right order, starting today? Welcome back to HEH. I'm Dr. Vivian Hart. If you've been told you have insulin resistance or prediabetes, you know the frustration. It feels like your body just isn't listening to you, especially when it comes to managing your weight and energy. You might have even been told that medication is your only option, but what if there was a different path? Research suggests that the body's ability to respond to insulin is not a fixed trait. It's a dynamic state that can be significantly improved with targeted lifestyle changes. And the best part? Some of these changes can start making a difference in just 7 days. Let's be clear, reversing insulin resistance is a journey, not a quick fix. However, the science shows that you can begin to shift your metabolic health in a positive direction within a week. A 2023 randomized trial published in the Journal of Clinical Endocrinology and Metabolism examined a combined 7-day low glycemic index diet and exercise intervention in older adults with obesity. The results were striking, showing that even this short-term intervention led to significant improvements in whole-body insulin sensitivity. This tells us something crucial. Your body is ready to respond positively, and it can happen faster than you might think. This is what we call the 7-day metabolic reset, and it's not a fad. It's a carefully designed protocol that gives your body a break from the constant metabolic stress of processed foods and inactivity. Let's break down what's happening. Insulin resistance occurs when your cells don't respond effectively to insulin, the hormone that helps glucose enter your cells for energy. Over time, high insulin levels can lead to weight gain, chronic inflammation, and eventually, type 2 diabetes. The goal is to improve your cell's sensitivity to insulin, and lifestyle is the most powerful tool we have. Research supports this. A 2025 study published in Current Nutrition and Food Science found that a 12-week lifestyle intervention, which included personalized dietary changes, led to significant improvements in insulin resistance. Another 2025 clinical program integrating nutrition counseling and personalized exercise significantly improved metabolic parameters and body composition. These aren't just abstract numbers. They represent real changes in how your body processes sugar and stores fat. Now, what can you actually do? Let's look at 3 actionable steps you can take starting today. Each is backed by research and designed to be practical. Step 1. Reassess your carbohydrate sources. Not all carbs are created equal. The 7-day study used a low glycemic index diet. This means swapping out high glycemic carbs like white bread, sugary cereals, and processed snacks for low glycemic options like steel-cut oats, lentils, non-starchy vegetables, and berries. These foods release glucose more slowly, preventing the sharp spikes that trigger a massive insulin release. Step 2. Incorporate short, consistent movement. The same 7-day study combined diet with exercise. A 2025 meta-analysis found that exercise, especially when combined with dietary changes, significantly improved insulin resistance. You don't need to run a marathon. A daily brisk walk of 30 to 45 minutes, or even short bursts of activity after meals, can make a substantial difference. It helps your muscles use glucose more effectively. Step 3. Reduce your eating window. A 2024 study published in the Annals of Internal Medicine found that time-restricted eating, like an 8 to 10-hour eating window, is an effective lifestyle intervention that modestly improves glycemic regulation. If you stop eating by 7 p.m. and break your fast at 11 a.m., you're giving your body a break from constant insulin spikes. This can help improve your cell's sensitivity to insulin. Remember, this is about starting the process. The 2025 study on progressive weight loss shows that as you lose weight, you see progressive decreases in insulin levels. It's a positive feedback loop. The more you do, the better your body responds. I want to share a quick story. A patient of mine, let's call him Mark, was in his late 50s with prediabetes. He was frustrated, felt like he was doing everything right, but wasn't seeing results. We started him on a simple 7-day plan. A low glycemic diet, daily walks, and a structured eating window. Within the week, he noticed his energy levels were more stable. He wasn't crashing after lunch anymore. The constant cravings were starting to fade. He realized that small, consistent changes weren't just manageable. They were the key to building momentum for long-term health. Make no mistake, reversing insulin resistance is a journey. But the research is clear. The journey can begin in just 7 days. The 2025 program we mentioned earlier showed that integrating nutrition counseling and personalized exercise led to significant improvements in metabolic parameters. This isn't about deprivation or extreme measures. It's about giving your body the right signals so it can start to heal. This week, choose one thing from this video to focus on. It could be swapping your breakfast cereal for eggs and veggies, or committing to a walk after dinner every night. The goal is to build consistency. Before we wrap up, let's address a common question. Is a 7-day change really enough? It's a great question. The 7-day time frame is a powerful launchpad. It's long enough to show you that change is possible, but short enough to be a manageable commitment. It helps you build momentum, and that momentum is what carries you through the next 7 days and the next. So here's your challenge. For the next 7 days, commit to these 3 steps. Give your body a break from the constant metabolic stress. You might be surprised at how quickly your body responds. This is educational content. Always consult your healthcare provider before making significant changes to your health routine, especially if you're on medication for blood sugar or insulin resistance. If this video gave you a new perspective on insulin resistance, share it with someone who might need to hear it. There's a good chance someone in your life struggling with the same thing and doesn't know where to start. Subscribe to HEH for more science-based health education. And leave a comment below. What's one change you're ready to make starting today to improve your metabolic health? I read every single one. I'm Dr. Vivian Hart. Start small, stay consistent, and I'll see you in the next video.